welcome to the Drug Interaction Checker and Resolver webinar by Mediately. I'm Blaž Triglav, the CEO at Mediately, joined by Dr. Roke Sheh, our medical advisor, and we'll walk you through our latest upgrade of the Interaction Checker that we launched late last year. And we have something really exciting in store, so I hope you'll enjoy what we have to show you today. So first off, maybe just as a big overview of why are even we discussing drug interactions. As most of you already know, they can result in pretty poor treatment outcomes if they're not addressed. And when we are doing surveys with our users, what comes up often is that more and more patients are taking more and more drugs. So the odds of interactions are increasing. 47% of doctors in our last digital doctor said their average patient is taking 5 or more drugs, which means that at that level of drugs, there's a big chance of an interaction happening. And the second part that we found out in that digital doctor survey is that most of you already use mobile apps and online drug interaction checkers. So we felt that since we already have the best mobile drug information app, we should also have the best drug interaction checker. And I think what we'll be showing today is going to only solidify that position for our interaction checker. Now, let me first walk you through our existing interaction checker functionality just as a brief summary. First of all, we partner with the Medbase, which is one of the best interaction database providers in Europe, on integrating their database into our interaction checker. What you can do in our current iteration is you can select up to 20 drugs, and this was specifically done so you could then enter the entire therapy of the patient. A lot of interaction checkers have lower limitations, but as we saw in our interviews and in our discussions, a lot of patients really have a lot of drugs, and it's important to see as many interactions as possible between all of them. Then immediately you see the severity of interactions and the consequences of that interaction. So for example, here we see a major interaction between clarithromycin and lercanidipine, and what is that consequence? But a lot of interaction checkers stop here. So you know the consequence, you know there is a major interaction, you know you need to address it, but you don't actually have a solution, which isn't really useful. So what we also provide is recommendations. These recommendations are written by medical doctors, clinical pharmacists, and pharmacists in recommending what could be an alternative drug to use in this case, or what is the next step that you can take as a physician with your patient, or as a pharmacist with your patient. And then you can also check what's the scientific background. In this case, the scientific background comes from the SPCs, but a lot of times the published research is also included. So there are our database provider Medbase includes both SPCs and clinical studies, just to make sure that all of the interactions are taken into account, not just those that are necessarily in the SPC. Now, what's next and what we're here to talk about today, and this is something that I'm really excited about. What we found out during the use of our current interaction checker is that in more than half of the cases, actually physicians enter or users enter more than 2 drugs. So it means a list of 3, 4, 5, 6, even up to 10, 15 drugs are entered. And in that case, the recommendations that I showed you before are useful, but not as useful as they could be, because even though you might potentially resolve an interaction between 2 drugs, you might trigger a new interaction with the rest of the drugs that your patient has prescribed. And in this case, so for example, this is a common case. You're trying to add a drug to the patient's therapy. You see there are significant interactions found, and you decide, okay, I will change the drug with that specific drug that is causing a significant interaction. But then the new drug that you're adding has significant interactions with the remaining drugs of your patient. So you're kind of stuck in this loop over and over, trying to find a drug that is going to actually meaningfully reduce the amount of interactions for your patient. Now, what is the exciting feature that we're here to talk about today is our drug interaction checker and resolver upgrade. So we're now the only interaction checker on the market that analyzes the interactions and suggests alternatives for resolving them. And what you saw before, that loop, actually no longer is a loop, because what we allow you to do is when you're trying to add a specific drug, you can compare these alternative drugs for the patient's therapy, and you can select an alternative without significant interactions for the entire list of drugs. So that means that you're very confident that you won't be adding any interactions, not just for the specific interaction you're resolving, but for all the drugs on the patient's list. And this makes the entire process of resolving interactions and figuring out the optimal therapy a lot simpler and easier. Now, instead of talking a lot about how it works, let's Dr. Roquechet will show you how it actually works in practice. Please, Roque.
Thank you, Blaž. So let's start first with a typical case, maybe with atypical pneumonia. Let's say we have a patient with arterial hypertension, already taking perindopril and lercanidipine, and we're considering adding clarithromycin for the pneumonia. So we go ahead and prescribe the clarithromycin, or maybe not. There's a major interaction between clarithromycin and lercanidipine. So how do we proceed? How do we resolve this interaction? Let's first take a look at the video, and then we will review some of the key steps. Here we can see the familiar interaction checker screen where we already added the relevant drugs: perindopril, lercanidipine, and clarithromycin. If we tap the interactions button, we can see that there is actually a major interaction between clarithromycin and lercanidipine. We can, of course, check the interaction details where we can read about the consequences, the recommendations, the mechanism of interaction, scientific background, and also check the relevant references. However, and this is what's new, we can also decide to resolve the interaction. When resolving an interaction, we have several options. We can decide to either remove or replace one of the problematic drugs, in this case lercanidipine or clarithromycin. So we decide to replace clarithromycin. On the next screen, we already have a list of suggestions derived from the ATC category, sorted according to severity and number of interactions, with all the drugs that we added to the interaction checker at the beginning. We can also use the manual search, but in this case, we decide to go ahead with azithromycin. When we tap on azithromycin, we can see all the forms and dosings available, so we can choose an appropriate drug. We can, of course, also check the SMPC details of a specific drug, including the indications and dosing chapters, and when we're satisfied with the replacement, we can tap Continue. We're then shown a preview of what is about to happen if we proceed with the replacement. In this case, by replacing clarithromycin with azithromycin, we will resolve the interaction completely. So we tap Confirm, and we see that there are no more interactions and that clarithromycin on the drug list has been replaced by azithromycin.
Great. I really love this. When we showed this to our users in the beta test, they said that it feels like the first useful interaction checker on the market, and I'm very excited that we can bring this to everyone. Rok, maybe if you can walk us through some of the key steps that we saw, and just to reiterate what are the advantages compared to using a regular interaction checker that people might use on the online.
Absolutely. First, the first key step is to remove or replace one of the drugs. We decided to keep both options, even though we are pretty confident that most of you will go for the replace function. Based on the user research we conducted during the development of this feature, we implemented two options to look for alternative drugs. One is the ATC-derived alternatives, where you're offered the alternatives based on the ATC classification. And the other is to perform a manual search, where if you have an idea which drug might be suitable for the patient and for the condition, you can search for it manually. It's important to emphasize that the interaction check is always performed against all added drugs. At the end, we preview the impact. Usually there will be no surprises here, but if you're not satisfied with the impact of the change, you can still go back and pick a different choice.
So with this, we're off to the question and answer session.
Thank you, Rob, for the quick summary. And as we wait for the questions to pop in, I really just want to say thank you to the team here at Mediately on developing this. We've all been excited to bring this to all of our users. And yeah, it's going to be, we're very much looking forward to the feedback from everyone as well. So please try it out, see how you like it, and give us feedback so we can make it even better. Rob, maybe we can look at the questions right now. See, I've seen some of them are already flying in.
Okay.
Okay. We have two questions already. Let me answer this first one live. The anonymous user asked if the interaction database is reliable and updated. So with our database provider Medbase, the way they work, they update all the interactions in the database every quarter, so 4 times per year. They review all the new literature that comes out, all the SPC changes, all the new medication that's added. So 4 times per year is the amount of updates that happen. And this is one of the reasons why we went with a up-to-date interaction provider, just because we believe it's really important that all the research, all the new knowledge is getting to all of our users as soon as possible. So yeah, it is very regularly updated and reliable, as it's done by a team of clinical pharmacists and doctors on the side of Medbase. Let's see what else flew in. Another question here. When will the resolver be available? It's available right now for every Mediately Pro user. So we released it this Monday. It's Wednesday today, and you can, if you update the app, you'll already have it available in the app. If you're already a Mediately Pro subscriber, you can just go and use your interaction checker as you previously did, and you'll already have all of the information there, and all the ways of resolving an interaction will be available for you already. This one is a similar question, but I'll just do it because it's quick. Is Resolver available for everyone? Everyone that's a Mediately Pro subscriber, absolutely. So everyone who has the app and is a Mediately Pro subscriber can try out the Resolver with no problem, with no additional fees. And let's see, there's another question. And this one is regarding the Pro subscription. Is it possible to pay for the Pro subscription through my employer with my business card? This is a question we get often because a lot of you only have your personal card on your phones. Yes, it's possible. We'll send some useful links after the webinar on how to subscribe as a business, just so you can then expense this as a business expense versus paying it out of pocket. And I think these are all the questions for now. I'll maybe wait for a few seconds more if any new come in. There's a bunch of new ones. Someone says looks great. Thank you very much. We're working on that. And if that's it, I think that's it. There is no new questions coming in. We like to keep it brief and effective. Just a second, maybe another one. Another comment that it's a great addition to the existing interaction checker. Yes, we really think it's a major upgrade. So yeah, enjoy it, go out, try it out. It's available right now. And like I said, send us feedback. We'll be in touch over email with all of you attendees with some additional information. And with that, I'll let you get back to your daily work and have a good rest of the Wednesday. Thanks, everyone.
Thank you, everyone.